Hi, I'm Brian Mandel, the editor-in-chief of the Cleveland Clinic Journal of Medicine, CCJM. Welcome to Beyond the Pages, CCJM podcast, where we will take you in depth into the content of selected articles from the Cleveland Clinic Journal of Medicine and explore a few interesting tangents along the way. Through moderated interviews with our authors and other experts in the field, we hope the clinicians will gain a more nuanced perspective of clinical concepts that are changing the practice of medicine and be able to apply this perspective to the care of our patients.
Thank you for joining us on another episode of Beyond the Pages, CCJM podcast. I am Dr. Craig Nielsen, staff physician in the Cleveland Clinic's Department of Internal Medicine. I serve as one of the vice chairs for the Department of Internal Medicine and Geriatrics, and I am Assistant Dean for Clinical Education for the Cleveland Clinic Lerner College of Medicine of Case Western Reserve University here in Cleveland, Ohio. Today we're going to talk about the article published in the Cleveland Clinic Journal of Medicine, Artificial Intelligence in Clinical Practice, a look at ChatGPT. I am joined by Fred Dang, Temerity Faculty of Medicine at University of Toronto, Canada. Welcome, Fred.
Hello, thank you for having us.
Fred, can you tell us how you became interested in this topic?
Yeah, sure. So I'm a second-year medical student, and a lot of my fellow students here at Toronto, we really like to play around with technology. And one day, our tutor was talking to us about a really difficult patient case. And we had this student who was sitting next to me, and he was just coming up with all of these amazing differential diagnoses, one after the other. I was like, holy crap, we have the next Dr. House here or something. But he showed me his secret afterwards, which turned out to be ChatGPT. And from that point on, that was when I wanted to learn a bit more about this technology and to do a bit more research into the topic.
That's interesting. Thanks for sharing. And also joining us, Dr. Anthony Bazzo, an orthopedic oncologist with McGill University in Quebec, Canada. Anthony, welcome. Who joined you in authoring this article, and what is your interest in artificial intelligence?
Thanks for having us today. So I use a bit of artificial intelligence in my research, different types of AI models than we'll be talking about today. But I'm certainly interested in the applications to healthcare research and the potential benefits for our patients. And so in addition to Fred, who's the primary author on our paper, we had Owen, Keon, and Yi Jin help us out on this.
Wonderful. Well, thanks again to both of you for being here. Now, let's go beyond the pages. So as we get started today, I thought it would be beneficial for us to define some terms to make sure we are all on the same page. So let's talk about AI, LLM, and ChatGPT. Can you kind of define some of the key terms that we're going to be talking about today?
Yeah, sure. So let's start with what is AI, because that seems to be a term that's, again, thrown around a lot lately. And if you look up the definition of AI online, you'll probably get a very philosophical answer, right? Like it's a technology that lets computers simulate human intelligence or something like that. But marketing speak aside, what they really are, they're computer programs that can find patterns in data sets. So a way to think about them is they're kind of like medical students. So I don't know if Dr. Nielsen or Anthony, if either of you still remember much from your med school days, but as a medical student, I learned during lectures by looking at patient cases. And we had a case recently where it was an older patient with respiratory distress. He had fever, he had hypertension, recent pneumonia. We were then told that the patient had sepsis. And the goal of this training exercise is so we can remember these presentation patterns and to associate them to conditions like sepsis, right? So when we actually go into practice, we can apply these patterns and find sepsis in real patients based on similar presentations. So AI works the same way. So if we show AI lots of patient information, like lab values and demographics and symptoms, and if we label which patient in the data set has sepsis, then the AI will learn to find patterns in these data and associate them with the sepsis diagnosis. Right? So if we now apply this AI program in a clinic and a new patient comes in, the program can look at the patient information and they can tell us that, okay, I've seen this pattern of lab values before, right? This is most likely sepsis, right? Just like how medical students apply their knowledge in a clinic. And so AI, or we sometimes call them machine learning algorithms, all they are is they're pattern-based predictors. They learn a pattern from data, they predict something based on those patterns. Now, AI is also a very general term, right? They describe a very large variety of tools that work on this principle. Some of these tools are good at finding patterns in numbers. Some are good at looking at images, right? Like looking for signs of tumors on MRIs. Those are the ones that people think are going to replace radiologists one day, by the way. And then you have language models, and that's where things like ChatGPT comes in.
Right. So there are different types of AI models for different types of inputs, you're saying, Fred. Some analyze numbers, some images, and in our case, what we'll talk about today, large language models deal with text-based input.
Yeah, exactly. So when we talk about large language models, it's a type of AI that's designed to find patterns in text. They're never trained on any sort of patient data, but they're trained on lots of paragraphs from books, websites, and Wikipedia. And from these data, they're trying to learn patterns in sentence structures, in grammar, and also they're trying to learn associations between words. So like which words are usually pretty close together in a sentence. And when you give these language models a new sentence to work with, all they're trying to do is they're trying to predict which word or character are most likely to come next in that sentence, given the grammar and the sentence structure and all the other patterns that it learned. So the way that I explain this to people is it's kind of like when you're typing on your phone. So a lot of phones have a feature where it tries to predict what word you were going to type, and it displays it on the top of your keyboard. So that technology actually works very similarly to large language models, right? It looks at the sentence that you have so far. It looks at the grammatical and contextual patterns of that sentence, and it tries to predict the next upcoming word. So when we talk about ChatGPT, it's a website that uses large language models. I think we all know what ChatGPT is by this point, but just in case you haven't heard about it before, it's a website where you can have a conversation with a so-called AI algorithm. So you can ask questions just like if you're talking to your colleagues, right? So you can ask it, tell me how to titrate SSRIs in a patient with anxiety, like a super natural way of asking questions. And then the website will give a very conversational answer. So people have actually used this type of technology as like customer service chatbots before. And most people can't even tell that they're talking to a computer program, right? It's really conversational. And it really seems magical to people who have never used this before. Like I was really shocked when I used it for the first time. It's almost like AI that you see in the movies, right? So it is powered by a large language model. And to understand how it works, we can kind of look back to texting on our phones. So with those suggested words that I talked about earlier, you know how if you keep tapping those words on your phone's keyboards, you can actually make a complete sentence based on those suggested words. Well, that's kind of what ChatGPT does. So it uses the user's input as a starting point, and it tries to predict which word is likely to come next repeatedly using a large language model, just like you tapping on the suggested words on your phone a bunch of times, until it forms a complete sentence.
Wonderful.
And because it's been trained on such a large corpus of literature, the responses it gives are more complete and thorough than your typical automated text function on your phone.
Well, that was very helpful. Thanks for reviewing that, because again, I think sometimes we talk about these terms, but we don't think about kind of the meat behind them. So, outline for us some of the current ChatGPT applications that are being looked at in clinical medicine.
Oh, so there are all sorts of things that are being looked at right now, right? There's a real hype around AI model in general. So some of the common applications are differential diagnosis and prognosis, right? So if you feed ChatGPT a patient case, can a website give you a list of differentials or predict the patient's length of stay or risk of death, that sort of thing? There's also interest in using ChatGPT to act kind of like a Wikipedia for physicians, right? To provide physicians with medical information. So if a clinician can't remember the dose for a medication or the latest treatment guideline, they're looking into if ChatGPT can provide that information for them. And then lastly, there are some efforts to use it for administrative tasks, like translating surgical consent forms and radiology reports to use more patient-centered language. There's also a lot of effort to use these models to make SOAP notes based on transcripts from patient interviews as well.
Well, thanks, Fred. As a primary care physician, I hear a lot about ChatGPT helping me in the practical day-to-day work. You've talked about a little about inbox answering patient questions, helping me with the electronic medical record, and potentially acting as one of my medical scribes and writing all my notes. Is this going to be the reality for me? Is this an accurate summary?
So as a medical scribe and for note writing, I think absolutely that's going to be something that's coming in the future. As a language model, again, this is what they're built for, right? To work with language. They're very good at finding patterns in text, and they're really good at picking out information for reformatting or for summarizing. There's actually a lot of commercial efforts to make this available, right? I think Microsoft is working on something like this with Epic. So you're going to see a lot of these kind of model-based clinical summaries in your EMRs really soon. Now, they will still benefit from human review. You can't just copy and paste them into your SOAP notes, right? It's like if you're dictating your notes, you still need to look out for errors. And again, the research isn't the best on this right now because it's not a very interesting application. But from a theoretical point of view, this is the best application for large language models in clinical medicine. In terms of answering patient questions, so I think that if you ask large language models common medical questions, like what medications can I use for migraine, or what are the lifestyle modifications for diabetes, it will probably give you the right answer. But we need to be aware that this is all based on word patterns and word associations within the ChatGPT model, right? It's not referencing clinical guidelines or any external resources. I think the example that we gave in our paper was that if the model sees the word diabetes and lifestyle, it's more likely to talk about diet and exercise, just not because it understands what diabetes is or how diet and exercise would help. It's giving that answer purely because those words appear in close proximity during the model's training, right? So if you ask ChatGPT to generate factual information, its output can be very variable and it could be incorrect. Especially if you ask ChatGPT about rare diseases, or if you ask it something that's very specific, like a specific part of a clinical guideline, it's probably not going to give you the correct information, or it's going to give you something that's very generic and useless, all things considered. So I wouldn't set large language models loose on your EMR inbox just yet. When we use large language models for this kind of purpose, we should try to focus on their language abilities. Again, they're good at looking for patterns in input and summarizing or translating. So a good way to use it is to type out an outline with all the information and facts in a list form that you want the patient to know, and then feed that into ChatGPT and ask it to draft a response based on those inputs, right? And these models are actually really good at emulating empathy and using patient-centered language. I think there was a research that was published in JAMA Internal Medicine that showed that it has a more empathetic messaging style compared to clinicians. So if you provide these models with an outline of your reply and you use it for the purpose of formatting only, the model's less likely to give incorrect information. And you also save a lot of time from having to plan out a response to the patients, right? So the model can do that part of the job for you.
Great. That was very helpful. What other limitations of large language models should clinicians be aware of in regards to the clinical applications that we may be seeing in the future?
So earlier, Fred mentioned how large language models can produce false information because these LLMs produce their responses purely based on word patterns and word associations. So this is one of the biggest limitations of LLMs, and we call these false informations hallucinations. And it's always possible that the large language model will hallucinate and give something nonsensical, but the rest of the grammar and syntax will be correct, so it can be hard to spot. That can be especially bad, for instance, if the model gave a slightly incorrect medication dosage. The other limitation of large language models is their inability to give the source for the information or recommendation that they generate. For example, if you give ChatGPT a prompt, give me the source for the answer you just provided, ChatGPT's response is, the information in the answer is synthesized from general training data. It includes a broad range of sources up to my last update, and it does not come from a specific source or article. So it can make verifying their answers a bit more difficult. Furthermore, large language models are programmed with a bit of randomness and variation in their responses, right? The creators didn't want the same generic response every time, but when there's one right answer, they're programmed for randomness or variation will mean their outputs can change, okay? And lastly, these hallucinations can happen because these LLMs are trained on a general corpus of literature, not specialized medical texts. So while large language models may be good at general conversations and they have an overview of many topics, the current versions are not designed specifically to know about one or more of the medical subspecialties in any great details. Future large language models may be trained on focused medical texts or NCCN guidelines, but those specific models would have to be extensively evaluated for performance in that specific domain.
Are there other ways companies are trying to overcome these challenges or potential limitations?
Really, the best way to overcome the limitation is to be aware of what it's good at. As Fred described really well, these are good at producing text, but they shouldn't be asked to do prognostic work or diagnostic work. Some changes to the way large language models get their data are seen in the Perplexity model. It uses a large language model to, instead of being trained on a general corpus of literature, it will find like Google's top answers and then summarize those for you and then be able to give you the sources. So that's one way to try to understand where is this data coming from. But overall, it just has to be used properly, and it hasn't been integrated into medical workflows just yet. Further testing will be needed.
Gotcha. This concludes part 1 of this episode. Please join us for part 2 as our conversation continues beyond the pages.
Thank you for your insights in helping us to go beyond the pages of the Cleveland Clinic Journal of Medicine. To read CCJM articles, visit ccjm.org. To participate in other accredited educational activities, visit ccfcme.org. You can subscribe to the podcast on Google Play, Spotify, or however you prefer to access your podcasts.